Hey, good afternoon. I'm going to go ahead and call this to order. Welcome to the April meeting of Board of Health. We do not have anyone for privilege of the floor, so we're going to move directly to approval of the minutes. So looking for a motion to approve as written. We have a first from Sabara, a second from our legislator. Any discussion? Edits, changes? Okay, all in favor is written. And all, yep, 1 second. Okay, let's go ahead and move to our business, which are our EH enforcement actions, which relate to water and sewage. Stating of the minutes. Okay, I'm sorry. Okay. Thanks, Brenda. Thank you for letting me know. Yeah. Okay. So our first draft resolution relates to Bailey Park. So let's go ahead and start with a motion to approve as written. Okay, and a second. And let's go ahead and open, I took Samara for the second. Let's go ahead and let me just ask Skip if you've got anything you'd like to add to the materials here.
Yeah, just a reminder that this situation was a case where there was an extended period where it was intermittent water at the park due to a water leak. It took them a while to find the water leak. At one point, they were going to go in and just start replacing screens. They ended up finding that a home was leaking. So anyway, we didn't propose a penalty because we want to encourage them to move forward with improvements to the distribution system. Because what we don't want to happen in the future is that if there's a leak, they should be able to isolate that leak so the entire park isn't impacted. So that's what we're looking to accomplish.
Okay, so I'm sorry, say it one more time because there's no fine in here. So the reason for no fine is.
Yeah, well, so we did issue a notice of violation and they did end up meeting the requirements of that notice of violation. However, because of the extent of the outage of water, we want them to improve the distribution system to include valves and other improvements so they can isolate future leaks.
Oh,
so if there is a leak, it doesn't take out the entire park.
Questions for board members? Need to vote? Okay, all in favor? That's unanimous. All right, let's go to the next one. Hold on, let me just get myself down here. Okay, so this one relates to Ithaca Estates Mobile Home Park. So if I could get a motion to approve this written, have a first. You see this one, Brenda? I get a second over here. So Skip on this one.
Yeah, so we're not quite out of the woods on this one yet. They are continuing to pump the septic tank. At this point, they're investigating to see if there's a water line leak that is infiltrating into the septic tank. So we're continuing to monitor this. However, the discharge that was occurring was not reported to us, so that's why we're seeking a penalty and continue to look at modifications to the system.
Questions from board members?
This was their first violation.
Yeah.
You ready?
Yep.
Okay. Let's go ahead and vote. All in favor is written. It's unanimous. Next one is for the Pencha Village Mobile Park. So if we could have a motion to approve this written. First from Christie, a second from Dr. Delima. Skip on this one.
Hanshaw Village has come to you a couple times for sewage at this point. So they have a pump station that is problematic. We did receive the engineer's report a couple weeks ago, so that's under review, and we're gonna be getting comments back to them on that. In terms of the penalty, we're seeking $1,500, 500 for the discharge of sewage, 500 for not getting the engineer's report on time based on the previous order, and then $500 for violation of Board of Health orders.
So do number 2 and 3 refer to the report you just received, or that's an additional that you need from the licensed professional?
Yeah, that's the report we were seeking.
Okay. Questions? Okay, ready to vote? All in favor, Skip? And that's unanimous again. Okay, those are all our enforcement actions. Thank you very much, Skip, and environmental health for those. So let's go ahead and switch to our monthly reports. And we'll start with you, Dr. Clayton.
Okay. The only thing I'd add is that as of last week, I believe it was, the influenza season was officially declared not to be widespread, and so mandatory masking for non-vaccinated healthcare workers ended. And there was also a study that came out, I think it was in Journal of Pediatrics, that confirmed that influenza vaccination significantly decreased emergency room visits, hospitalizations, and office visits as well. So that's that type of information we need to promote amongst the public, even though it doesn't eliminate all influenza spread, it does keep people from ending up where they don't want to be. So that's all I have to add.
Thank you. So one thing I noticed in the report, just because I actually was interested in it, in the section on avian influenza, you wrote, here's a short recent video of Kevin Hines from the DEC, but there's no link in there.
Oh, my goodness.
Can you just add that link?
Yeah, I'll do that.
In case there's anyone of our adoring public fans who would like to read that as well. Thank you.
Yeah, sorry.
And I do have a question, and that may be the next report. Do you have any information, Dr. Claybash, about the CDC study about the COVID vaccine that was not published? But I think what I'm reading through the grapevine is it shows great results, but we are not seeing it.
Right. So that was a study that came to the director of the acting director of the CDC, and he quashed it, charging that the data collection methodology was not appropriate. That methodology apparently, by accounts that I've read, was a standard methodology that had been used for other reports at other times. So on 2 counts, it was highly unusual step. First of all, it was unusual for the director to sabotage. Shouldn't use that word. To release a report that had been vetted by the scientific staff at all levels below them. So that was one unusual feature. And the second was that the methodology that they charged was not appropriate, was standard methodology that had been used before.
You know, if it's published somewhere, I've been looking because I want to read it, but I have not been able to find it.
I have not seen that.
Okay.
And we have a New York State conference weekly call tomorrow, so I could ask if anyone knows
Okay. Thank you.
if it's been published.
Questions? Thank you. Jenny.
All right. The first thing I wanted to highlight is that we had several staff that attended the New York State Public Health Association conference last week in Lake Placid.
And
Well,
I went too, but not as a board of health person, but I happened to be there.
I turned the corner and there was Christina.
I was like,
And it was great. We had, Sam gave a presentation about healthy neighborhoods. There was a presentation for all of the other public health directors, talking about opportunities to use ROI in public health and how you can calculate that and talk about it with policymakers, legislators, et cetera. And part of our work advocating for healthy neighborhoods program had included some efforts to sort of quantify the ROI of our healthy neighborhoods program. And so NICHO had seen that and asked if we could sort of be the use case in this presentation. So Sam joined and presented on that. So that was great. And then all three of our fellows had wonderful posters. Let's see if I can do this off the top of my head. So Rika had a great poster about qualitative studies around pediatric dental access, understanding barriers and opportunities to expand pediatric dental work. Anushka presented about the CHA-CHIP process, including the use of the MAP process and the community collaboration, which she presented to you all a couple months ago. And then Allison, who's a fellow in environmental, presented, her poster was about environmental surveillance around wastewater, particularly looking at surveillance around changes to PFAS and lead regulations. And it was so fun. They did a great job. Their posters were really neat. I would say we were the most well-represented local health department at the poster section. So that was great. And then Allison actually won an award as Public Health Fellow of the Year.
Excellence in public health or something.
Yeah, so that was great. So I'd say we had a great showing and we certainly learned a lot and went to some really interesting panels and presentations that have been trying to bring some of those lessons back. The next thing, this is just like a real success that I wanted to highlight. So the county at several different levels is looking to refine the process for human and social service providers that receive grant funding that is typically allocated through the Human Services Council, through HSC. And in the past, I think it's just sort of been, my understanding, this is a little bit before my time, but there were organizations that always received funding. The funding kind of just went through. There wasn't necessarily a coordinated discussion around priorities or things of that nature. And so I've been involved both from the HSC county admin lens, talking internally, as well as sitting on the Health and Human Services subcommittee with Christy to think from both of those angles about how this process could be improved. And one thing that we are bringing to this is that we will be using the CHA and CHIP priorities to guide the funding decisions from the county budget through the Human Services Council to community partners. It was a very long, maybe run-on sentence, but the point is that I think it is really wonderful that we are seeing partners and county admin and legislators really coalesce around those priorities, and that we're not duplicating work. And that when they say, we should identify what the community priorities are, that I was able to say, we've done that. And here they are. And so that's really exciting. And so we're still kind of fleshing out that what that will really look like. But it's a really great opportunity and really shows that our CHA and CHIP are having impacts sort of across the county. And let's see, the last one, we had a really great open house with Senator Leah Webb's office. All of our programs had different posters and activities that kind of illustrated the work that they did. I thought it was super interesting and they were all very fun. I certainly learned a lot. And so that was really wonderful. We'll look to do more sort of open houses and sort of maybe bring a road show of some of those posters. And then I will give a pre-plug for Rachel, who recently raised to me a question about buying more kits around ticks. As she may report, we are already seeing an uptick in the
Well,
I'm not intended. And we saw some really great tweezers at this conference you're at, and really love to expand that. And I would sort of pose to you all, is there an opportunity for like braided funding streams to kind of buy some of these tick kits across our different entities? So when we give them out in our materials, I'm sure Cornell is trying to also educate students about risks of ticks. And I don't know if you guys hand things out. I'm sure the same at CMC. So it'd be great if there's some way to braid some funding and buy a lot of these like kits for outreach. And I'll pass to Rachel now.
Oh, wait, before you,
Yeah. Oh, question.
yes, before you do that, questions. I actually have a question about what if anyone else has questions. So I was curious about the $10 million that Ithaca got for the downtown revitalization project, which I know very little about. I've done very little reading on it, but I think I wanted to just ask if the health department is at the table for any of those discussions, particularly as we think about like the healthy neighborhoods concepts, et cetera, that like when we talk about like kind of building on what you just said, like that,
Yeah.
that when they're thinking about how they're, whatever they're going to do to revitalize, that we're thinking about the whole health concepts and that that's integrated into the design process. So if you're not at the table, I think I just wanted to encourage that I think there should be like a health voice at that table.
Yeah, that's a great
Business.
point. We are not at the table. I don't know if there is a table yet, but I will reach out and find. We have been really, there's been more information sharing,
Okay.
I would say, with the city, even in terms of sort of like enforcement reports and things like that, but also on other projects. So I think this is another opportunity and I can't imagine they wouldn't welcome that. It's a great point.
Okay, thanks. Okay, any other questions, comments?
So since Jenny had this nice lead in for ticks, I'll just mention that probably a lot of you or most of you subscribe to your epidemiologist. So that was just recently, the newsletter included that ER visits for tick bites are triple the rate that they usually are this time of year. And I think it just speaks to like a warming climate generally means that tick season is getting bigger and bigger. Like it used to be, we'd see an inactive period of the year, and now we're seeing, it used to be May was kind of the start. We're in April still. So, and yes, I would like to pursue some real nice fine-tipped tick tweezers. There's always issues with using state aid to purchase giveaway items. They really don't like us to do that. And New York State used to give us these tick kits for free. I'm going to check in with someone there just to see if there's any hope that might return or if we need to just purchase these on our own. But so that's what, and we are seeing locally from the communicable disease batch that we pull every day. Like there were multiple, positives on the batch yesterday. So we're just getting, more people.
What would be the distribution mechanism for those?
We just take them to every outreach event we go to.
So it'd be just the health department and not other partners,
Right, yeah, it would be at like fairs, Ithaca Festival, whatever we can, people stop by and we say, here's what we do. We talk about preventing tick-borne disease. Do you want one of these?
But I thought if we bulk order.
Yeah.
And there's some rated funding for that, then if there's like, print out outreach events, like like we could just get a tremendous amount, so community partners could also have them to take out. I don't know if that's possible, but it's worth asking about, or,
Or even like, So I volunteer with the Finger Lakes Land Trust and we do a lot of trail clearing and I douse myself every time I go out, and there's Cougar trails, and I don't know if organizations like that might be a point of distribution outreach or something.
I also wonder about what, is being distributed amongst the general population so that they do have easy access to information.
Right.
But this is a really bad tick season now.
Yep.
I mean, granted, it's being given out to like those who were interested in certain sites and things like that, but is there a way that the health department kind of puts out that information that this is particularly bad tick season now, and how to track yourself to look at yourself every night?
Yeah, I mean, we used to have a communicable disease like blast fax, which always cracked me up that we were just blast faxing, and I'm not sure if provider offices actually pick things up off their faxes and read them. We have
You're get two confirmations.
boxes are not the common way the information is these days.
So Dr. King's bulletin is often how I, distribute things to provide.
Yeah, I think we also, your Dr. Kate's
Right.
bulletin, but
Yeah, the bulletin and I distribute to the medical staff at large.
I'm even talking about like going even to the population.
Yeah.
How to, not just
We
through
do
doctors.
social media. We do social media posts. We usually do a press release.
Okay.
Kind of reminding folks. And a lot of tabling, like Rachel's team has these really wonderful but gross bagels that have ticks, and it's the tick or the poppy seed game. So that is sort of
I was wondering what bagels had to do with it.
yeah.
Ticks are the same size as the poppy seed, so it's like find the tick on this bagel and then try to go eat a bagel after that. I mean,
Um,
I think a bagels won't be appreciative of that.
But I had thought of, I had sort of said like, it's too bad we don't have like a parks department, but we do have like the Finger Lakes Land Trust and some of these other entities. So those would be great partners too. To really try to work with.
And the only thing I wanted to mention was our work on oral health. Sagarika has been really wonderful. Her time with us is about to end, but she put together a really nice white paper presenting all of the work we've done up to this point, our proposal for a program that could work to help with some of the issues that we're seeing with access and prevention, especially for children on Medicaid, or children with no insurance that are struggling to access dental oral health care in the community. We've shared that with Jenny and with the coalition that we have. And, we're just going to talk about next steps, probably funding, putting together something that that could benefit the community. So.
Question regarding, not necessarily regarding the HIV. So I think it was last week, I caught a small snippet of a story on NPR regarding the Ryan White program and the AIDS Drug Assistance Program, ADAP, and how a large number of states are slashing and perhaps even eliminating funding for that program and the impact of people coming out of remission and so on. So I don't know if you know anything on the state level, whether New York State is going in that direction or not.
I've not heard anything about changes at the state level to funding. I know we have
I know some states have really gone, I
AIDS
think Florida's
Institute.
really gone crazy with it.
yeah.
Yeah, I haven't either. I mean, New York State has a really robust the AIDS Institute.
Yep.
So I think that would be a very dramatic shift away from the posture that they've taken in the past. I'm really kind of leaning into this work. So
Some of the rationale in the story, states were slashing it, trying to balance their budgets. And that was a program that they saw was an opportunity to do that.
it has not come up. I mean, we've been tracking the state budget, which is on yet another budget extender at the moment. And I've been sort of following along like our key programs that could be impacted, and I haven't seen or heard an outcry from
I was
advocates
just curious.
around that. So I think that is no news is good news in this case, perhaps.
The meeting we just had, that I mentioned in the report, we invited some community partners to talk about HIV prevention in the community. And staff did come to that meeting and say they are struggling with a lot of things right now, funding, staffing. And they are currently sort of lending them a nurse to do HIV testing a couple months or twice a week down at the staff office here, just until they fill that staffing position. But we're doing our best to kind of work with them and help them through a rough patch with their organization. But they want funding from us, and I'm like, we don't have funding, but we can help you access resources. Dr. Lima, did you have? You're here.
Fingers crossed. Any other questions? Okay, Sam.
Yeah, I just want to highlight that coming up in May is Mental Health Awareness Month. And so we have some staff who've been very involved in planning and will be present at the Better Together event, which is next Saturday at Stewart Park. And if you haven't been before, it's really a great event. Lots of community partners and people enjoy it. So yes, hopefully the weather will be good, but I'll be next weekend. Only other thing right now. Thanks.
I just had a question about the highlights that HHS reviewed resolutions to accept funding for the dual settlement and children and youth with special healthcare needs. I just didn't quite understand that. Like we sent something in?
Yeah.
Okay.
You want me to? So the way we transfer funds is through resolutions that go to the HHS subcommittee.
Okay.
So when we want to.
This is at the state level?
At the
Okay.
county level.
All right.
Yeah. So when we want to accept funds for grants or move large funding chunks around, those become resolutions
Okay.
that go through the HHS subcommittee and then allow us to make those budgetary changes.
Okay. And so we're accepting that funding to do what?
So the dual settlement funding, will support either a position that will be a health educator position, that used to exist. Ambra was in that role previously. It presented when we talked about youth vaping probably 6 months ago. We're looking at that as one option. The other option would be to support, contracting out, which we may do some portion of anyway, with Rural Health Institute Network, which or somebody. I mean, we would do an RFP to do an education campaign around youth vaping.
Okay.
And then the children and youth with special healthcare needs is funding that will fund 0.5 of a community health worker position. We'll focus on doing referrals and coordination for children that meet the eligibility criteria for this New York State program.
Got it. Okay. Thanks.
And that's a program that we've had before, housed within children's special care needs upstairs, because it's related, but it covers a larger age span difference, like up to 21, I think. Whereas children's special care needs is primarily, early intervention or 0 to 3-ish. So this is a supporting like transitions from, different school age groups and post high school, that kind of work.
Hey. I think Jessica's here, right? Yes. Is there anything? This is now referred to as Chisin. That's what we learned at the public health conference. We were like, what is Chisin?
Yeah.
Then we realized it was children with special.
You said chin.
So that's referring to this other program that Jenny was just talking about, the resolution.
Okay, like, what is that?
Urinate children
And
youth with special healthcare needs we thought was SHIN at the state level, but then they pronounced it differently at the conference, but then CSCN is still CSCN.
Okay, anything about this one that people have questions about? Okay. And then Skip?
Yeah, similar to Kicks, it appears that Habs are making an early appearance. So we got a report from CSI that Habs were identified up in the northern part of Cuba Lake. It's not in Tompkins County, but still not a great sign for the coming year. So just wanted to share that. Also, just to kind of give a quick update on Asteri. We have developed an inspection form, so we're gearing up to start follow-up inspections beginning in May. We've gotten a couple of complaints, and we've seen a couple reports from the city where, there has been some some issues reported, so hopefully, you know, the next couple days they have things situated, but we will be going out here soon.
And are those unannounced visits from you?
Yeah, I think the plant, yeah, they will be unannounced. We did share the inspection form with Asteri, so, you know, they should be well aware of what we're gonna be looking for, and
And so even after the fine, there were additional reports that were coming in of concerns?
yeah, we received a couple complaints. I think the conference center sent us an email. We received a couple inspection reports from the city of Ithaca. They were in doing code enforcement follow-up. They had noted a couple areas where trash had accumulated. So we'll see. If we identify violations, our intention is to meet with management and go over the violations that we've observed. And then we will be going back the next day to make sure that it's been corrected.
Okay, and then how will you be levying the $2,000 a day fine if they don't do what they're supposed to do? Like,
Yeah.
have you started that process?
So the way I envision this working is we'll go through, you know, almost a month's worth of inspection. And then, depending on how those inspections go, we will be drafting a resolution to bring back to the board for consideration.
Okay. So that would have to come back to the board again before you can,
Yeah, because we'll be seeking additional penalties of $2,000 per violation.
even though we already told them that would happen, it still has to.
Yeah, I think it still would come back to the board.
Okay.
Yeah.
Comment,
Please.
just want to say, your good representation on the news. I heard on your voice on the radio,
Yeah, it's
describing things, and I appreciate the work that you've done.
appreciate the feedback.
Agreed. I think there's a WSKG story too, that I haven't heard yet, but there'll be more. Other thoughts or comments? Okay, I think that is, did I get everybody? I think I did.
Okay, so we have covered all items on the agenda. So Holly has said that I do need to ask for a motion to close the meeting, adjourn the meeting. I have a first and a second. Did you catch those, Brenda? And then second from Christie. Any discussion or concerns on that? Okay, all in favor? Unanimous. Thanks, everybody. Thanks, Holly. Bye. Everybody have fun.
Have a great day, everyone.
Not almost saying, we are trying to reduce our packet